The mission of the CEAR is education, teaching, and also research. We have a fellowship program. We teach medical students, residents, and fellows. And we also provide services to Shriners Hospital and our veterans and the VA hospital. Some of the researchers do the clinical research. I am one of the scleroderma person, and I have done the research for the last 25 years. We also have Dr. Andrew Uroko, and he does some of the immunology and microbiology research. And we also have other researchers which are adjunct faculty from microbiology and immunology.
We're providing excellence in patient care to the entire area of North Louisiana. We offer innovative and cutting-edge cancer treatment. Along with this, we offer clinical trials and clinical research to the patients in our region, bringing access to drugs and treatments that our citizens would not otherwise have. In addition, we have a mission of research and sponsor both basic and clinical scientists who have multiple grants for our institution. Our Partners in Wellness service not only offers clinical care and screening services to patients, but also is a keystone of our outreach research program. It is a public health effort throughout the north half of the state to reduce cancer incidence and to study ways that we can have an impact in reducing cancer in our state.
The CCDS is a group of over 40 clinical and basic science researchers established to drive clinical and basic cardiovascular science on our campus. One of the biggest things that have happened in the Cardiovascular Center are our new training initiatives. We established the CURIOUS program that provides undergraduate research opportunities for underrepresented minority students. We had our first batch of students that came in this past year. During this last year, we also had our first annual Heart Health Day, which is a free community health screen and educational event. This next year, we're actually going to try to build this even larger and combine it with the Architects Cardiology Conference. In addition, over the last year, 4 of our CCDS postdocs successfully competed for extramural postdoctoral fellowships from the American Heart Association.
The program is a collaboration between clinicians, researchers, and educators to provide cutting-edge care to patients with brain injury and disease in North Louisiana. We've had a lot of success in looking at Alzheimer's disease, so we have some current funding to look at some blood markers of the disease, which has been very successful, and we're currently enrolling patients. One of our current projects is a collaboration with the biomedical engineering folks over at Louisiana Tech. We're interested in studying Alzheimer's disease and dementia, and the interaction between dementia and sleep disturbance, specifically sleep apnea. I'm particularly excited about this collaboration because it may provide us with an intervention that we can offer people in our community, potentially slowing down the progression of this horrible disease.
CTERM is the Center for Tissue Engineering Regenerative Medicine, which was created in 2019, and it's intended to develop stem cells for use in research and in clinical medicine. And it's a partnership between LSU Health and Louisiana Tech with their partner, LifeShare, in Shreveport, Louisiana. CTERM is important to the region because it is creating a new center for development of technologies with enormous commercial potential. The industry that can be developed around the use of stem cells for applications in stroke and in cancer and in bone reconstruction are vast. One of the important things that CTERM is developing right now is the use of placenta-derived stem cells, which is something that has not been widely used but has enormous potential applications in clinical medicine. Hopefully CTERM is going to represent an important commercial entity in the city of Shreveport and in northwest Louisiana. And we fully expect that it's going to lead to the development of new jobs, new centers, and the partnership with LifeShare should lead to the development of a lot of technology that is really cutting edge across the nation, if not internationally, and it started right here in Shreveport.
The Louisiana Addiction Research Center, or LARC, at LSU Health Shreveport is the newest state-approved center on our campus, and it's building upon 35 years of translational research into addiction, substance use disorders, and treatment. For the last 25 years or so, we've been studying the influence of stress and drug addiction and how certain triggers in the environment can produce a stress response in the brain that then leads to craving and then leads to relapse. And we've developed drugs that block the ability of these triggers in the environment to initiate this stress response and thereby reduce craving and help to reduce relapse in individuals. We've also started to look at the cardiovascular consequences of methamphetamine. Methamphetamine has huge effects on the cardiovascular system that are only just now starting to be recognized, and some of the work that's being done between LARC and some of the other centers at LSU Health Shreveport are beginning to unravel these mechanisms involved.